Hi there. Welcome to the Conversations on Climate Change and Health. I'm Yaw Boafo, and I'm excited to have you join me on this journey, a long-overdue conversation as we explore the intricate relationship between our changing climate and its impact on our health. Today, we're delving into a critical yet often overlooked topic, the effect of climate change on cerebrospinal meningitis. We have Dr. Yaw Boafo with us, who's a senior research fellow at the Center for Climate Change and Sustainability Studies. I'm actually very excited. We can't wait to hear from you. To start, let's consider the basics. Cerebrospinal meningitis, meningococcal meningitis, is an infection of the protective membranes covering the spinal cord and the brain, which is caused by various pathogens. So it normally attacks the spinal cord, which when immediate care is not taken, it can cause paralysis or death. Patients with the condition always experience severe headaches, stiff neck, high fever, and are always restless. Some patients die after a few of them exhibit the symptoms when they do not seek immediate medical care. But how does climate change fit into this picture? Stay with me throughout the episode. Let's connect the dots. Studies have shown that warmer climates can lead to longer transmission seasons for meningitis-causing bacteria. Increased rainfall can also create ideal conditions for the growth of these pathogens, while droughts can also stress populations and lead to higher rates of infections. Hi, Doc. Thank you very much for joining us here.
Thank you, Yaw, for having me. I feel very privileged to be given the opportunity to delve into these two very critical issues facing Ghana and Africa as a whole. That's these issues of climate change and then the persistent threat of cerebrospinal meningitis. And I'm very eager to share insights on the complex interplay between these concerns and explore the actions we can take as a nation to safeguard our environment and public health. So thank you once again.
Now, Doc, we'd love to hear from you. So what's your perspective on cerebrospinal meningitis and its prevalence here in Ghana?
Thank you once again, Yaw. So cerebrospinal meningitis, as we popularly called CSM, is a very grave or public health concern, particularly in sub-Saharan Africa, including Ghana. It's a bacterial infection which can rapidly turn fatal if not treated promptly. And even with treatment, it can leave survivors with lasting disabilities. The meningitis, built across Africa, where Ghana lies, is particularly prone to outbreaks due to what we call very favorable conditions for the bacteria. So, for instance, in early 2023, for instance, the outbreaks of meningitis was reported heavily in Ghana, with cases primarily concentrated in the Upper West region, of Ghana. And so, if you look at the Streptococcus pneumonia and the Neisseria meningitis, these were identified as primary causative agents of the CSM. And what I also know clearly is that the Ghana's health services maintains an active surveillance for meningitis, particularly in the dry season between October to March, where outbreaks are more likely to occur. Yep. So these are some of the key issues that I think are of importance at this point in time. But I also state that the actual number of reported cases may actually be higher, because the challenge we have is that there's always been underreporting, and this makes it difficult to provide also what we call healthcare access to several areas within the areas of concern.
So, Doc, we'd love to know, you've done some work around this topic, the effect of climate change on cerebrospinal meningitis. And we'd love to know, is there any climate variables associated with cerebrospinal meningitis outbreaks that was identified during or even after your study?
So our study identified a very strong link between specific what I call climate variables and CSM incidence. I mean, for instance, high temperatures and increased sunshine coupled with the low rainfall and humidity were significantly associated with CSM outbreaks in the areas that we did our work. And these dry and dusty conditions often exacerbated by, harmattan winds, which are very key in northern Ghana, create an environment where the CSM bacteria thrives. And so again, additionally, we also observed that whilst climate change is intensifying, and I think the evidence is very clear from, the Ghana Met and several studies that have been done, CSM cases and mortalities have been decreasing in recent years. And this is likely due to improved vaccination programs and public health interventions that have taken place within these zones over the last couple of years.
Thank you very much. So moving on, that there's some symptoms of cerebrospinal meningitis asserted by respondents during your study.
Some of the symptoms that were asserted by respondents during the study, and let me say that this study that we did was done in 3 key districts in the Upper East region, and the district where we have the Brusa North municipality, we have the Kasana-Nankana municipality, and then the Kasana-Nankana West district in the Upper East region of Ghana. And in terms of some of the key symptoms that came up, community members demonstrated what I call a good understanding of the key symptoms of CSM. They commonly reported what were called severe headaches. Also, there were people who reported high fever, stiff necks, and vomiting as key indicators of the disease. I think that this awareness is very vital for early detection and seeking of timely medical attention, which again can significantly improve the outcomes that we expect. So the fact that people were able to point out these key symptoms for me is a very important outcome of the study.
Okay, Doc, thank you very much. So moving on, can you please highlight some adaptation strategies and also some policy implications of the study?
Well, our findings highlight the urgent need for what I call climate-informed public health policies to combat CSM. And I believe that given the recurring nature of CSM, it is important for policymakers to prioritize what I call the proactive measures like early vaccination campaigns, especially during the dry season when outbreaks are more likely. Additionally, improving or what I call the housing ventilation is very important. There's also the need to obviously promote environmental sanitation. These are very basic things, but environmental sanitation can play a key role. And again, a practical thing is to raise more awareness about CSM transmissions as it is, because at the end of the day, addressing climate change through efforts such as afforestation or sustainable waste management and even clean energy initiatives can also contribute significantly to reducing CSM risk in the long run for many of these communities in northern Ghana where, the disease hampers general well-being of people and livelihoods. There's a need to develop systems that monitor climate conditions and then can help predict, potential CSM outbreaks. But also it's important for enabling timely public health responses, because sometimes the outbreaks are inevitable, but how do we prepare adequately to address these outcomes? Another adaptation strategy will be what I would call trying to empower communities to identify and report CSM cases early enough, and this can go a long way in facilitating rapid response and then containment efforts. I also want to say that within this broader scope, we have to look at building or retrofitting homes and healthcare facilities to ensure that there's adequate ventilation. And I talked about that earlier. And this can also be helpful in reducing overcrowding, which can also, go a long way in limiting the disease transmission that we talk about. And more generally, we need more public awareness and education, because public awareness and education, of communities and households about CSM symptoms, transmission, and preventive measures including vaccination, can be critical to reducing the burden that it comes with, in these already very poor and marginalized communities in Ghana.
All right, public awareness and education. Thank you very much, Doc. I'll come back to you. Let me quickly read these comments. So this is from Raman, and Raman says, the rain does not fall at the correct time these days. It will fall at a time when you don't expect it to fall. These days, it also falls very much when we don't expect it. I think the rainfall pattern has changed. At one time, you experience very heavy rainfall over a very long time, which leads to floods. And at other times, it only drizzles over a couple of days, causing drought and dusty conditions. These are the challenges we are facing. This is from Kwesi, and Kwesi says, the best way to prevent CSM is to avoid the indiscriminate deforestation and embark on massive tree planting. Preach on, Kwesi. This will help reduce the amount of sunshine and heat emanating from high temperatures from reaching us on Earth. We should also keep our surroundings clean all the time. This is from Amina, and Amina says, I think health providers should continue to embark on public health education about the disease. They should also conduct CSM vaccinations before any outbreak of the disease. We also need to modify our buildings to improve ventilation, avoid overcrowding in our rooms, sleep in well-ventilated rooms, drink a lot of water, and we should cover our mouths and nose when coughing or sneezing in public. The next one is from Trumesi, and Trumesi says, climate change is really affecting our health in so many ways we can imagine. We now grow trees along the boundaries of our communities and within our houses. We have taken to various afforestation projects to improve upon the natural environment. We have also planted canopy-top trees that offer various degrees of shade in our backyards. It is these trees that we get shade during the daytime when temperatures rise so high. Okay, thank you very much. Don't forget to send all your questions and comments to climatehealthpodcast@gmail.com. So, Doc, please, any last words? I must say this has been very insightful.
Thank you, Ajua, for having me on your podcast today. It was a pleasure to discuss such a critical issue. And as we conclude, let's remember that nature holds many of the solutions we need to combat climate change and the spread of diseases like CSM. And I think that when we invest in sustainable land management, reforestation, and ecosystem restoration, we not only mitigate the effects of climate change, but also we create a healthier environment that are less conducive to disease transmission. So nature-based solutions, as we call it, are not just options. I think they are more or less necessities. And so I encourage everyone to stay informed about CSM and climate change, and to support initiatives that aim to improve public health and build a more resilient future for everyone in Ghana, regardless of where they live. So thank you for having me.
Thank you for joining us. So, until then, I encourage you to observe the changes around you. How has your local environment changed over the years? How might these changes be affecting your health and the health of your community? Mind you, a healthy population is the foundation for prosperity. Thank you very much for joining us on this journey to understand the complex relationship between climate change and health. I'm Echa Brokwa, and this is the Conversations on Climate Change and Health. Until then, stay curious, stay informed, and take action. Thank you. Hi there. Welcome to the Conversations on Climate Change and Health. I'm Yaw Boafo, and I'm excited to have you join me on this journey, a long-overdue conversation as we explore the intricate relationship between our changing climate and its impact on our health. Today, we're delving into a critical yet often overlooked topic, the effect of climate change on cerebrospinal meningitis. We have Dr. Yaw Boafo with us, who's a senior research fellow at the Center for Climate Change and Sustainability Studies. I'm actually very excited. We can't wait to hear from you. To start, let's consider the basics. Cerebrospinal meningitis, meningococcal meningitis, is an infection of the protective membranes covering the spinal cord and the brain, which is caused by various pathogens. So it normally attacks the spinal cord, which when immediate care is not taken, it can cause paralysis or death. Patients with the condition always experience severe headache,